All right, let's get started. Hello, everybody, and welcome. I'm Fred Turner, CEO and co-founder of Curative, and today we're going to share a little bit about what's at the heart of the Curative plan, the baseline visit. We'll be aiming to demystify the baseline, what's involved, why we do it, and show its true impact on our members. We've got quite a bit of content to get through, so if you have questions, put them in the chat and we'll try to answer them as we go, but we likely won't have time at the end for questions. But you can always follow up with your sales representative or email sales@curative.com at any point if you have questions, and we will be sending a recording of this presentation out afterwards as well. All right, so to introduce the guest speakers you're going to be hearing from today, we'll have Dr. Mark Levy, who is our SVP of Clinical Services and runs the clinical team at Curative, delivering the clinical portion of the baseline visit. We have Josh, who is the Care Navigator lead at Curative, who will be talking about the Care Navigator portion of the baseline visit. We also have Jeanette Abbey joining us. She is a benefits consultant with Navora in Texas to share more about her perspective on how the baseline visit is being perceived in the market. And we also have Nicola Ellis, the HR director at River Oaks Country Club, a Curative client, to share more about how to maximize the baseline visit and maximize completion rates, and her experience with the baseline visit. So as you're likely aware by now, the Curative plan is a little different. Our main differentiator is that the Curative plan design is no copays, no deductibles, no really. We remove the financial barrier to our members getting care by actually focusing on preventative health and supporting our members in getting healthier. We believe that better health depends on care that people can actually use and afford. So that all sounds great. What's the catch? We hear this all the time. Is this too good to be true? How can you offer this at zero? How does this work? Well, the catch is we actually want members to be healthy. The Curative plan design is very different. Everybody for the first 120 days gets access to this $0 out-of-pocket cost. But during that 120 days, they have to complete what we call the baseline visit. And we'll be talking a lot more about exactly what's involved there. But it's a meeting with your Care Navigator to get oriented with the plan and a conversation with a Curative clinician. And as long as you complete that baseline visit, you'll continue to have no out-of-pocket cost for the whole plan year. However, if you don't do the baseline visit on the 121st day, you will revert back to a $5,000 deductible 20% coinsurance plan. So it's a very big carrot and stick incentive to engage in preventative health. Just once a year, it's all we ask. Think about your health once a year and you'll have no out-of-pocket cost. Members really love this. We get 98% average completion across our groups of the baseline visit. So for most people, $5,000 is a big enough incentive to show up and engage in preventative health. We do measure the NPS, the Net Promoter Score, after the baseline visit. We're currently averaging 76, and this is up there with top brands. Yeah, I think the traditional health plan NPS, you're usually doing well if you're in double digits. And people give 4.8 star and 4.9 star ratings for the clinician and the Care Navigator portion. So members really like and enjoy the baseline visit. So before we get into what it is, what sparked the idea behind this? Why did we decide to set up the plan this way? Well, as we're approaching building a new commercial health plan, we wanted to build something different from the status quo of the BUCA plans that are out there. We wanted to build something that actually helps people to improve their health, and a plan that people could get excited about offering to their employees, and a plan that we could be excited about offering to our own employees. And so from the beginning, there was really two issues that we identified with current health plans that we wanted to address. Affordability, getting people the care they need without financial barriers in the way, and engagement. Everybody's busy, right? We all have reasons and excuses why we don't engage in preventative health, why we don't get the screenings, why we don't go to primary care. Getting that engagement early before there are problems and getting people into care before things are going wrong is really key to improving those long-term outcomes. And so we did a lot of brainstorming and designed the baseline visit to address both of these issues, right? We achieved that affordability by getting members the $0 out-of-pocket benefit. And we achieve that engagement by getting 98% of our members to actually sit down and think about their health at least once a year. And so that's really, the key behind how we designed and built the baseline visit. So what is the baseline visit? With anything new, it's unknown. It can feel mysterious or intimidating until you actually complete it. So we want to share a little bit more about what's actually involved, and then what isn't involved. So first off, the majority of the visits are virtual. We do them over Zoom. It's typically a 45-minute to an hour-long call. We do have an option to do them on-site in Austin, and we can also do on-site visits at employer locations. But primarily, most people do their visits virtually. They are available in the evenings and weekends. And it starts off with unrushed time with a curative clinician, really focused on discussing your health history, health goals, and looking for gaps in care, right? Looking for people who maybe know that they should see a doctor and haven't been for 5 years or 10 years or ever, and have kind of been putting it off, knowing in the back of their head that something needs to be dealt with, but there's always an excuse of why we'll just do it next year. We really want to get those people connected to care. Then there's a meeting with the care navigator. This is somebody you'll have access to throughout your curative journey. You can text them, call them, email them. They're there to help you. And they really go over and explain the benefits. So we want to make sure that everybody comes out of the baseline visit with a genuine understanding of how their benefits work and how to actually access the health plan, right? It's one thing to offer a whole bunch of programs and, things that members can use. But if it's not obvious to the member how to actually get that care, right, it's not going to work. So we really make sure that our members understand the plan, understand their benefits, and come out of the baseline visit, knowing how to get access to the care they need. We do also offer the opportunity for some screening blood tests. This includes the Grail Gallery multi-cancer detection test. These blood tests are optional. They're offered for members if they want them, but they're not required as part of the baseline visit, but are strongly encouraged. It's great to get that check-in and see how you're doing. The information is 100% confidential. It's not shared with the employer. We also have a firewall between this information and the underwriting team. And of course, the baseline visit is 100% free. So what isn't the baseline visit? Obviously, this is a new concept. We often see it kind of conflated with other things. The baseline visit is not your typical health risk assessment. I'll say a bit more about that later, but it's very different from what you might be used to with a traditional health risk assessment. It's not a test. It's not something that you're rated on. It's not something you can pass and fail. It doesn't impact the premiums or your ability to participate in the plan in any way. It doesn't matter what we find during the baseline visit. It's not going to affect your premium. It's not going to affect your benefits that you're receiving. It also doesn't impact renewals. None of the information from the baseline visit is available to the underwriting team. It's also not a replacement for a primary care doctor. A key goal of the baseline visit is getting our members connected to primary care. So we don't want this to be viewed as a replacement for having a PCP. It's really the first step in the journey to getting members that access to care, and having a PCP is a key part of that. So what are some of the differences between the baseline visit and a traditional health risk assessment? Well, during the curative baseline visit, we pull your data in advance. So we're able to pull in years worth of medical history so that the clinician can come to the conversation informed already about what's going on with your personal health journey. We do this from the very start of the plan within that first 120 days. So you're already getting everything you need right at the beginning of the plan year. And I think really the key difference, this third line here, is that the goal of the baseline visit is different, right? For an HRA, you're typically just looking to kind of find diagnosis codes and write them down. For the baseline visit, we're really looking to catch undiagnosed, potentially preventable illness as early as possible, and then drive a meaningful intervention with the member, right? And that may be getting them connected to primary care. It may be getting them referred directly to a specialist. It may be getting them started on a drug. But whatever it is, we want to actually find those missed opportunities for care and not just document them. We want to directly intervene and get that member into the care that they need. It's an unrushed appointment with a clinician. So they're not just going down a checklist, they're genuinely having a conversation with the member about their health needs. It also is a true onboarding to the health plan. You'll hear more about this from Josh later, but really going through the benefits and making sure the members genuinely understand how they work. And we also include a significant amount of follow-up. So usually there will be items that come out of the baseline visit that members need to take care of. And the Care Navigator team will follow up with the member, help them with scheduling appointments, help them, whatever that next step is, but really trying to kind of drive that next step to completion, again, with the focus being early prevention and early detection. All right. Given the novelty of the baseline visit, it can be hard to explain. People are often anchored in traditional approaches to health plans. So let's hear from a broker in Texas, Jeanette, who's been selling Curative from the very beginning. Jeanette, welcome.
Welcome. Thank you for having me. I appreciate it.
So I'd love to hear a little more about, what did you first think of the baseline visit when you first learned about it?
Well, initially I was concerned that it was going to be kind of viewed as a big brother. However, the more you think about it, it's really ingenious. Having a healthcare plan truly interested in meeting you where you are today and helping you determine where you want to be tomorrow and actually helping you get there is pretty amazing.
Great to hear.
Yeah.
What are some of the reactions you get from clients for the baseline visit? What do you hear from employees at their open enrollment meetings, and what kind of questions do you get?
I get lots of questions like, well, is this confidential? Is this going to impact my premiums? Are people actually going to do it? Do you require me to do this? What are my expectations? If I share information, is that going to change stuff? Those are kind of the things that I get from employees. From clients, I hear, my employees are not going to do this. How am I going to actually get them to do this? You don't understand my people. They're not going to do it.
Yeah, we hear that a lot, that my employees are different.
Yep, exactly. I think there's such an opportunity for employees to just get better through this. I think it's a challenge that they are to access care that they have not really been able to get before. I can say that within my lots of groups that I've put on since then, that only I think 9 people out of the hundreds and hundreds of employees that we've put on to Curative, that I think only 9 have not completed their baseline visit. We always find some way to make it work, either using computer, online. We've brought the Care Navigators actually on site to some of our groups, and then just doing via phone call. I know I've actually gotten onto the phone with some employees that are just like, I just don't want to do it. I was like, why do you not want to do it? It's like, this is really important. They're not going to share any information to others. I mean, this is truly, they care about you. It's totally different. It's outside of the norm of a healthcare plan. And, then people are like, okay, all right, I'll do it. So then we get them scheduled and then they do it. So.
Yeah,
good.
Makes sense.
Yeah.
And what are some of those reactions you've gotten kind of after that baseline visit, after you've gotten people over that hurdle?
So I know that I've had several employees that have come back to me and said, I really appreciate this. I'm very intimate with my groups and, really try to take care of them the best that we possibly can. And, I will actually follow up with them and say, all right, I need to know, like, how was it? And I'm like, this was really amazing. Like, I never thought that I would be able to share the information that I did share. And it's not judgmental. It is a true opportunity to share things that I haven't been able to. And I'm actually going to get the care that I have foregone for a long time and kind of going on my way.
And what do you think some of the greatest benefits and value for members is in doing that baseline visit?
I think having just the ability to be able to talk and not have to worry about sharing the information that they may not want to. The fact that it's not going to impact their premiums. It's a supportive conversation and just kind of being an advocate throughout the whole entire process. I mean, I'd say on the clinical side, I tell folks, feel free to share what information that you're dealing with. They're truly there to help you and can help you get through whatever process that you're going through.
Yeah. I think it kicks off a very different relationship, right, between
100%.
that individual and the health plan.
Yeah,
Usually the first
100%.
time people talk to the health plan, they're angry about something.
100%. Why didn't you pay my claim? Why are you denying this? Or, I can't afford this. Why do I have to pay this big deductible?
Right.
So it just removes it all. It's amazing.
Is there any advice that you'd share with employers that are looking at this for the first time, kind of new to the concept, and maybe have some hesitation having been through the process?
Well, I can tell you it's this whole entire process is changing lives for the better. And I've got multiple folks that I have talked with through those conversations that I can think of one person in particular that during the baseline visit, and this is a construction company that has got very limited resources, and there was a language barrier that was there, and one person shared that really wasn't feeling great, and during the baseline visit, the follow-up and everything through that, they said, you need to go and see a doctor. So I went and got him to see a doctor, and ended up he had stage 4 cancer. So got through all of that treatment, everything at a $0 cost, which impacted him greatly. I mean, just saved his life. And he's now actively back at work after treatment. I mean, what more can you say about it? It's just amazing.
It's great to hear there's real world stories of the
Yes,
impact this is
exactly.
having. Yeah. Well, I really appreciate you sharing your perspective.
Thank you.
And, thank you for the ongoing partnership.
Yeah, appreciate it. Thank you.
Excellent. Thank you. All right. So now let's dive into the baseline visit and touch a little bit on the experience firsthand. So I'm going to hand over to Dr. Mark Levy, our SVP of Clinical Services here at Curative. He's been instrumental in leading the build out of the baseline visit and hiring the team of clinicians. And then after Dr. Levy, we'll pass it on to Josh, the Care Navigator lead, who trains all of the incoming Care Navigators. All right, Dr. Levy, I'll pass it over to you.
Thank you, Fred. Hello, everyone. I am Mark Levy. I'm a family medicine physician, and it's my pleasure to walk you through what a baseline visit would entail. The visit takes about an hour, which is about 30 minutes with one of our clinicians and then 30 minutes with the Care Navigator. Before the visit, the member completes a brief questionnaire to provide some basic health information. It's actually easy and doesn't take a long time. Also, before the visit, they have the opportunity to get blood work done and to screen. Through that blood work, we screen for diabetes and check cholesterol values. Again, not required, but it's a good option. We encourage people to do it. And we provide clear instructions about how to get that done. And the results are then available in the visit itself. The baseline visit is time for us to get to know the member and to understand their particular needs. The clinician starts off by introducing himself and describing the purpose of the visit. At the beginning, we'll ask whether the member has a primary care provider. We encourage them to connect with one and explain why, and let them know that their Care Navigator can help them find someone convenient and who's in network for them. Then we get into that member's health history and ask about any ongoing conditions or other health concerns. And really from there, we provide the time for the conversation to go wherever it needs to go to meet their needs. We certainly ask about medications they might be taking. This is a particularly important area because we want the members to understand and benefit from our formulary and pharmacy. Next, we'll ask about their family medical history so that we can provide personalized recommendations for preventive care. We discuss their lifestyle habits, including diet, exercise, sleep, and finally, whether they've been getting preventive care, including cancer screenings as per their age and gender. After those sort of general health history questions, I always ask, is there anything important that I've missed regarding their health? We really want to be sure we understand each person's concerns and priorities. The clinician will conclude the visit by providing actionable next steps. These might include diet or exercise adjustments, and depending on age, recommendations to get those cancer screenings done, and also vaccines that could be helpful to them. We stress the importance throughout this visit of the importance of primary care and having a primary care provider. Members in Texas now actually have the option to have our own curative clinical team serve as their primary care providers. And in closing, I want to say we want to be sure, our goal is to be sure that each member is set up for success, that they have a clear understanding of next steps for their health and of what services and resources are in place to support them. Then we hand off to the care navigator. Josh?
All right, thank you, Dr. Levy. Yes, hello, everybody. My name is Josh Hallisey, one of the care navigator leads, and just going to spend the next couple of slides talking about the impact that the care navigator has in conjunction with this baseline visit and how we're there to help the members navigate their healthcare journey. So as Fred mentioned earlier, first and foremost, the care navigator is assigned to a member from day one of that enrollment. If they have access to or very proactive to logging into their member portal, they can see who their care navigator is that's assigned to them. And should they have any more pressing questions, immediate questions, they can definitely reach out pertaining to any of the benefits that they may be looking to utilize on the plan. This occurs even before that baseline visit. Now, when we actually do conduct the baseline visit, this is the actual first face-to-face meeting between the member and the care navigator. And again, this goal is just to make members aware of all the resources that they have at their disposal and how we can assist them navigating that. The biggest difference between Curative and many other health plans is that instead of just providing a benefits booklet, we really take the time to interact, develop that rapport with each individual member and understand like how we can meet them where they need to in their respective locations. So kind of going through some of the steps here, as I mentioned, they're assigned a care navigator from day one. And then we do introduce ourselves prior to the baseline visit. And then during the time of the baseline visit, we give them an orientation to the health plan. And you'll see a couple of slides moving forward of that interaction and description. Additionally, if they have some primary care providers already established, we do help verify in-network status of those providers. Usually they are already in-network. However, we can assist as needed for bringing those providers into the Curative network. And for those families that do have younger children, if they have an established pediatrician, we can also assist with checking on that as well. And as Dr. Levy mentioned, we do encourage and can help submit referrals for Curative primary care for those who are local to the immediate Austin area. One of the other cool things about the in-network resources that we have is the provider lookup tool, allowing members to kind of find a primary care provider that's either close to them at home or close to work. Additionally, any specialists that they might see or need to find resources for pertaining to special conditions, we can look them up for them or at least provide some recommendations. We also assist with registering and signing up for telehealth or any other additional programs, which we'll cover here in a minute. And then some additional local pharmacy support or making use of the internal resource of the Curative pharmacy. And finally, just kind of leave the meeting with any answers to questions that members may still have that are lingering, and then can also set up recurring check-ins with those members should they have them or want to be a little bit more proactive and interactive with their care navigator. So ultimately, the goal of the time with the care navigator is to leave the member with a better understanding of all the resources available to the member during their time with Curative. So over these next couple slides, we'll just go over what the care navigator covers. So as has been mentioned, we do maintain confidentiality through this baseline visit, and just reiterating that there is no impact to their healthcare premiums or costs through anything that they discuss. Our ultimate goal is just to make members more aware of the resources that they have available. And by completing this and checking out of that baseline visit with the care navigator, that's what locks in those $0 benefits for the remaining plan year. So we always like to just make sure that folks are comfortable with certain healthcare terminology. We understand that members can vary from, very seasoned members of the workforce with a lot of time, a lot of different health insurance coverage over their career, or they may also be younger members. This is their first job, first opportunity with health insurance, or even younger dependents who are doing their baseline visit and getting health insurance coverage for the first time. We want to make sure that they understand kind of what these terms are and how to set them up for success later. And moving on to the next slide, I know we talk about deductible coinsurance and out-of-pocket maximums and stuff, but by completing the baseline visit, we really strive to keep everybody in that white box with blue text, letting them know that deductibles, coinsurance, and copays are all at zero for staying in network. So basically, this is the quote unquote money slide for what we bring to the table. By completing that baseline visit, you can see everything highlighted there being at zero. And then as has been mentioned, when we do a renewal visit or those who are non-compliant with the baseline visit, then we do revert to a traditional health insurance plan in which those deductibles and coinsurances would apply. We still offer some support for being in network. And then there are plans that do offer some out-of-network support too. We also make sure that regardless of who is completing their baseline visit, that all their dependents are covered. So anybody over the age of 18 does need to complete a baseline visit. We do treat all adults or those over 18 independently. So we know that there may be a policyholder, spouse, several adult dependents. Those that complete the baseline visit get locked into that those $0 benefits for the remainder of their plan year, but we treat those others independently. So if somebody happens to miss their baseline visit, it does not affect individual members of the plan. And then for those with dependents under the age of 18, they are automatically covered thanks to their parents or guardians completing their baseline visit. Prior authorizations, we just try to ensure members understand that there are certain services, treatments, prescriptions, things that their provider might recommend over the course of their healthcare journey that require a little bit more examination and kind of verification prior to receiving said procedure or service. So usually the care navigator team will connect with that provider or work with the member to connect with their provider to ensure that any paperwork that needs to get squared away in advance of those procedures gets taken care of. Sometimes members come to us with a kind of laid out plan or treatment plan already established, and they're just looking for verification, making sure that they can still attend those appointments. And then we work with that member and their provider to ensure that the things are submitted on time and that they get approved without us having to reschedule any appointments. All right, Dr. Levy.
Thank you, Josh. I'm going to describe two real examples of how the baseline visit has helped people. We've de-identified these cases, but the details are real. George is a 45-year-old construction worker. He'd not received any health care in years. When he did get care at all, it was last minute, NERs or urgent cares. really didn't even know where to start to get to a better place for his health. In his baseline visit, he expressed a lot of concern about his health. Among other things, he was drinking more alcohol than he thought he should, and it was interfering with his life. As part of the visit, he had blood work done, and indeed his blood sugar, cholesterol, and liver function markers were all abnormal. And as if that wasn't enough, his blood pressure was also high. Importantly and interestingly to me, he was actually really relieved to have the opportunity to address all of this and have the time to talk about it. There was a lot to discuss, but he and the nurse practitioner had the time. Specific next steps were recommended to him. We were able to send him a blood pressure cuff at no charge. And based on his good experience in the baseline with our nurse practitioner, he opted to continue with them for primary care, which again, we now offer for members in Texas. They had a virtual follow-up visit the next week, and over several months and several follow-up visits, he really made a lot of improvement. A lot of improvement was seen objectively, and he feels better. Perhaps most importantly, he now has a completely different and positive outlook about his health and future. So this was a really gratifying case and example. Josh?
Hey, Dr. Levy. Yeah, so in George's case, once the clinician wraps and turns it over to the care navigator for George's baseline visit, with his more recent diagnosis of type 2 diabetes, that can be something that's certainly challenging for somebody to hear and kind of navigate what their next steps are. So the care navigator would go ahead and submit a referral over to our case management team, in which they support diabetes management, helping George understand like how to manage certain blood sugar levels, A1C levels, and just get a general feel of how he can move forward with this diagnosis. Additionally, Pelago, which is our most recent partnership for helping to manage certain addictive behaviors, he gets access to that one-year virtual program that can help navigate and make some lifestyle changes for the better. And then additionally, our partnership with HEB all across the state of Texas gives members access to HEB dietitians. So in George's case, looking to do some adjustment on his nutritional habits, he has the opportunity to work one-on-one with those HEB dietitians to kind of help make those positive changes.
The next member that I'll describe is Myra. This is a very different kind of example, but also very important. Myra is a 55-year-old woman who's a director at a nonprofit and is very proactive about her health. In her baseline visit, she had a lot of questions about lots of things, but in particular about her cancer risk. The clinician took a detailed family history and from that was able to make personalized recommendations for her. And these included some hereditary cancer screenings that she was previously unaware of. The doctor also discussed with her the option of the Gallery test, which is a relatively new blood test to screen for a range of cancer types, actually 50 different types. The doctor discussed the test's potential benefit and explained that it can augment, though it is not meant to replace, more established cancer screening tests. She was really grateful for this information and indicated that she wanted to proceed with that. And again, we emphasized to her the importance of having primary care so that she had someone to partner with as she took those next steps. Josh, back to you.
Thank you, Dr. Levy. So yes, in Myra's case, she's one who is very attentive to her healthcare journey. Likely her primary care provider is already somebody she's been established with due to her nature of annual checkups. So the care navigator can support in the way of making sure their primary care provider is already in network. And if not, we can assist Myra with bringing their primary care provider into network and so that she can continue to see them. Additionally, with respect to the Gallery test, yes, the clinician did kind of inform her of what it screens for. We just help connect the dots and give her access to that Gallery test so that it can be completed at her convenience, as well as the details on what to do upon completion of that test. Additionally, working with Myra and her providers, we can ensure the upcoming preventative care visits are covered to avoid any delays in her care, making sure that things are managed as needed. And then our care navigators are fantastic as far as reiterating and answering any questions that Myra may have, depending on, you know, if it's something new that's brought up, if it's something that they've been dealing with for a little while, as well as with Myra's attention to her health concerns. We make ourselves available via phone call, text message, or email, so at the member's convenience, to answer any questions on what may be covered via benefits of the plan.
All right. Thank you, Dr. Levy and Josh, for sharing those examples. It's really great to see the positive real-world impact that the baseline visit is having, you know, on our members. That's just a snapshot of some of the baseline visits, but, you know, we've done tens of thousands of these at this point, and the impact that we're having on our members and our population is very real. So we wanted to share some of the feedback we've gotten from members about the baseline visit. You know, these are all anonymized from a survey that we conduct after the baseline visit. I won't read them all out directly, but, you know, generally an incredibly positive, overwhelming experience. Members love their current navigator. Definitely kind of this feeling of before the baseline, having some fear. You know, one member said, I was dreading the baseline, honestly, just thinking it was another thing, but doing it pleasantly surprised her. I think it really establishes a different relationship between the member and their health plan. And we're trying to make sure that members get that concierge level of care, that everybody across the population can have access to concierge level medicine and feel genuinely connected to their care. So really great to see this feedback that we get from our members. So the baseline visit, you know, provides real impact and improved health engagement. Instead of people being conditioned to avoid care, we're really encouraging our members to get care proactively and when they need it. And that allows a lot of care to happen in a preventative setting, a lower acuity setting, you know, avoiding some of those downstream costs of that care happening later, but in a higher acuity setting like an ER or a hospital. And so I'll share some data on how this has been going. So the baseline visit, you know, really begins the journey to better health. As Dr. Levy and Josh talked about, you know, really focusing on preventative health maintenance, setting up that PCP relationship, discussing age and gender-based screenings, you know, looking at vitals and lab results and a review of the family history, and then really looking at chronic condition management, identifying chronic conditions early and helping our members access the tools to do something about it. And then getting members that might need it connected to utilization management and case management so that we can get, you know, time-sensitive interventions in place, make sure any prior authorization requirements are dealt with, as Josh mentioned, ahead of time and setting those members up for success. And we're able to identify 94% of people with a chronic condition during their baseline visit before we ever receive a claim for any services. So this means where a traditional health plan, you know, would have to wait for something to go wrong and get a claim on your undiagnosed type 2 diabetic or your pre-hypertensive patient. You're waiting for that bad thing to happen before you can actually intervene. We can be proactive. We're not waiting around. We know what is going on, and we can actually step in and help our members access care before they're in that escalated setting. So, you know, we're really able to drive this prevention through the baseline visit. One key thing we focus on is getting our members signed up for the telemedicine service. So we use Norman MD in Texas and Teladoc outside of Texas. This is a telemedicine urgent care service, very good for avoiding some of the unnecessary ER utilization. You know, that you often see people running to the ER when something could really have been an urgent care visit. And most plans offer some kind of telemedicine service, but there's a big difference between, you know, sending people a letter saying, hey, you have this Norman MD access, and actually going through during the baseline visit, making them download the app, making them set up an account, and showing them how to actually initiate a visit. And then when you're in that urgent situation, you're not scrambling to say, hey, where's the Teladoc letter that the plan sent me? Maybe it's in the filing cabinet. Maybe I shredded it. You just open up the app, you already know how to use it, and you hit the button. And so we get 75% of our members register with the telehealth service during the baseline visit, and 20% of our members actively engage with the telehealth urgent care service during the plan year. It's about 5 times the Teladoc national average utilization. So our members really use this service. Again, the key is getting them set up ahead of time so that when that urgent situation occurs, they already know what to do and they're prepared. And that avoids a lot of unnecessary ER visits and the cost that would be associated with that. Secondly, we're really focused on chronic condition management, so identifying members early. We get 46% of our type 2 diabetics directly into a curative condition management program. About 70% of our type 2 diabetics and hypertensive members have an active PCP relationship, and our medication adherence is off the charts. We're at 95 and 93% for medication adherence. I think a big part of this is not charging members a copay to get the drugs that they need to stay alive, but also we have the curative pharmacy available. We will deliver the drugs to your house for free same day. So we make it really easy for members to get their medication. And keeping these adherence rates so high actually allows us to keep members healthy and prevent unnecessary ER visits and unnecessary hospitalizations. And we're already seeing this play out in the data. We're seeing this work. So on these charts, the red line is curative. The 3 lines are the Milliman National Plan benchmarks. So poorly managed at the top in the dark blue, medium managed in the light blue, and well managed in the gray. And usually the Milliman well managed benchmark is like an aspirational thing for health plans. You never quite get there. We're consistently running about 30% below the well managed benchmark for inpatient admits. So all of this engagement, this medication adherence, this getting members into preventative care early pays off in keeping our members out of the hospital. Just within the first plan year, we're seeing this dramatic decrease in hospitalizations. Keep our members healthy, that decreases the long-term cost for the employer, and it keeps a happy and healthy workforce. So it's really great to see this paying off in the numbers so early. We expect this trend to continue, based on what we're seeing with the engagement from our members. All right. So one thing that is really important is our work with the employer to encourage the adoption and the completion of the baseline visit by the member. So next, we're going to hear from a curative employer. We're going to hear from Nicola Ellis, who is the HR director at River Oaks Country Club. Thanks, Nicola, for making the time. Hi.
I'm happy to be here.
Excellent. So, what's your company's experience been so far with the baseline visit?
Well, just to set the scene, we're a country club. We have about 500 employees, and we needed 248 total people, including employees, spouses, and children, to do the baseline visit. We started our first plan year in December, and we do have a very paternalistic organization here. We do a lot to help our members, who are about a third are Spanish speakers. We have everything, across the board from hourly to salaried. We have most of our people do not have a desk. So we worked really hard with Curative, and we as in the HR team and the leadership team, to touch all the employees as many times as we needed to encourage them to get the baseline visit.
Excellent. Yeah, what are some of the tools that you've used to encourage members to get that baseline visit done?
Again, we have a lot of our employees prefer not to speak English. A lot don't have emails, or if they do, they don't use them. They don't know how to get into them. So we really have to touch everyone in multiple different ways. From the flyer, I'm walking around the club, like putting up flyers on walls at above time clocks. We group text message. We emailed in groups. We then, when we got down to a manageable number, we were emailing people individually, texting people individually. And we were, we knew who they were. So we were sort of tapping them on the shoulder when we were in the cafeteria or walking by them in the corridor and so on, reaching out to their head of function to encourage them to go and get it done. And Curative were also doing a bunch of stuff on their side, sending out the same kinds of things. So it did take time. It was a big commitment. And in the end, some people just didn't do it. We had 10 people that didn't complete out of 248. But it's worth it, right? Like it's, we're already very early days, but our metrics coming back from y'all are the best they've ever been. So we're thrilled.
Excellent. Great to hear. What was the feedback from the employees who did do the baseline visit? What have you heard from your employees?
I mean, I don't hear all the feedback, you know, because I'm the HR director and people don't like to look me in the eyes. But we have generally had like no negative feedback, absolutely none. We had a lot of grumbling beforehand, which Jeanette talked about. Do I have to? I don't want to. Big Brother, deep state, it's a waste of time, all of that. And we just kept on going and helping them understand it's confidential. All the things you've been talking about, it only takes an hour. You won't have to pay anything. And then after they did it, it was complete silence. We haven't heard a single thing. I know a lot of people are loving the programs, particularly the weight loss programs. And I think it very quickly, it was very quickly obvious that it was worth the hoop, that it was worth jumping through the hoop. Yeah. And we were talking before the call, I'm really intrigued to see what happens when we renew, because I really expect people to just get it done quicker and just see it as an absolute necessity to get their family to do it as quickly as they can as well. I hope so.
Right. And hopefully those 10 who didn't will hear from their peers about the $0 healthcare they've been getting all year.
Right.
And get it done. What advice would you give to other employers that are considering offering Curative?
I think that what I would say is that getting your people through the baseline visit does take time and is an investment. So be ready for that and be ready to touch people, as you know, quite a small number of people many times to get them over the hump. But we worked so closely with the Curative team. Honestly, at one point we had 3 of y'all helping us get this done. And they very soon figured out that we really wanted the data daily on who still hadn't done it. Towards the end, like the last couple of weeks, we were like, we need daily data. Got the daily data first thing in the morning. And you know, it wasn't easy and it did take time, but if we can do it, anyone can do it. I mean, we're over sort of a few 100 acres of land. There are a lot of barriers to entry, but in the end, it was the good old fashioned kind of, you know, constantly going out and reaching out that got us there.
Yeah, it's worth that investment, right?
It was worth the investment. Yeah, it's worth it.
Yeah, no, that's really great to hear. Well, really appreciate you taking the time to share your insights and your experience with baseline visit.
Thank you.
Thanks. All right, and just to emphasize, as Nicola mentioned, we do partner very deeply with employers and make a lot of information. We have information for open enrollment meetings to emphasize the baseline visit. We will send out emails if we have accurate email addresses. We will send out direct mailers. We will send out SMS messages if we can get phone numbers from members. We have template emails that employers and HR can use directly. If they want to send the communications, we have posters that you can print and put up in the office. Template, SMS, intranet reminders, and we're more than happy to take custom requests. If there's things that you think would help get your population engaged, get people completing the baseline visit that we haven't thought of yet, we would love to work on those with you and partner with you. We want everybody to complete the baseline visit. We don't want anybody ending up in that $5,000 deductible tier. Our focus is to get everybody into that $0 out-of-pocket plan. We do have a series of videos that are available on YouTube we can send them out and share them as well. These are just a couple of minutes long, but kind of preparing members to understand what it is that they're going to be experiencing with the baseline visit. They're available in English and Spanish. Hopefully this is helpful in answering some of the questions that we often see employees have, and what is this baseline visit? And again, just to emphasize, almost all members do take up this incentive, 98% completion rate so far. We have a very diverse set of groups on the Curative plan. We have everything from law firms and software companies to mushroom farm. And we're still able to drive this engagement. We're really focused on accessibility and getting the plan to work for everybody. Everything is available in English and Spanish. We do also have a translation service available, and we can provide the baseline in 210 languages via that translation service. So very accessible and easy for members to get their baseline visit done. Ultimately, we know this is just the first step towards better health, but the first step is often the hardest. And we're really trying to make this easy with the baseline visit. It's an opportunity to engage members, educate them, and finally to invest in that long-term health and outcome of our members. And we're really proud to be able to do this at Curative. All right. Thanks, everybody. Thank you for listening. If you have any questions, you can email sales@curative.com or your particular sales representative. And as mentioned, we will be sending a recording out after this presentation.